other than by oral ingestion?
By diffusion from the surrounding specimens.
You're talking about redistribution.
No, I'm not.
What is the difference between diffusion and redistribution?
Specifically talking about the gastric sample, I'm talking about diffusion from the surrounding specimens.
What is the surrounding specimen you're talking about?
Well, if my anatomy class reminds me a little bit, the liver's close by, the blood samples are close by, the blood itself.
Now, if it comes in to the stomach from the blood supply, that is redistribution, isn't it?
It's being redistributed from high to low.
And we've already agreed that lorazepam is not subject to redistribution, is it?
I didn't agree to that at all.
Well, you read the writing by Basalt yesterday. Is that correct?
I'll ask and answer the objection.
Overruled. Do you disagree with what Basalt said?
Basalt.
The objection is sustained. It's been asked and answered.
Are you familiar with a book entitled Medical Toxicology by Dart?
I am not, no.
Okay. So, in essence, what you are saying is that lorazepam can come into the stomach through redistribution. Are you saying that?
Saying it can get into the stomach via ion trapping.
Ion trapping is what holds it in the stomach, isn't it? It's not what gets it into the stomach.
Again, I understand the gist of this. I have a general knowledge of it. But when you start talking specifics, you're starting to get out of my area of expertise. And I would prefer to stay out of this.
Okay. So you really cannot explain anything other than oral ingestion as a means of getting lorazepam into the stomach.
Objection. This states the testimony. This is all beyond his area of expertise.
Overruled. You may answer it.
I can testify that I have personal experience that drug levels can be detected in the stomach of many different types of decedents from many different types of drugs, and they were not given orally.
And those are drugs that are subject to postmortem redistribution, isn't it?
Again, they're basic drugs that we commonly find in gastric analysis. That does not necessarily mean they were orally administered. How they got there, I would rather leave that for the pharmacologist to testify to.
Do you have experience with a decedent having lorazepam in the stomach that was not orally ingested?
I do not have personal experience with that particular drug, lorazepam.
That's all I'm talking about. Lorazepam.
I do not have personal experience with lorazepam.
But you do have personal experience of other drugs being in the stomach that weren't orally ingested.
That were not orally ingested, yes, I do.
Such as lidocaine.
Such as lidocaine, such as fentanyl.
Okay. The other drugs that you measured, this ephedrine, that is not at ephedrine being just present in the urine would not be at a therapeutic level, would it?
You cannot relate urine values to blood values.
Okay. The diazepam up there, that's not at a therapeutic level either, is it?
The diazepam is very therapeutic.
It's therapeutic, but it's not at a therapeutic quantity in the bloodstream here, is it?
Therapeutic, I don't know.
The bedazzling in the heart blood, 0.0046. That's not a therapeutic level either, is it?
I don't know the therapeutic range for midazolam, so I can't answer your question.
So I'm beyond your expertise again.
Yes.
Now, you came to a quick judgment that propofol was the most important drug in this case, didn't you?
Yes, I did.
Because you analyzed everything for propofol.
That's correct.
The razepam. Did you ever come to the recollection or the realization that that was an important drug in this case?
Objection relevant, Your Honor. The test speaks for itself.
The objection is sustained.
Did you think that lorazepam was not significant in this matter?
Objection relevant.
Overruled.
I think it has its importance, but it's not the red flag that caught my eye.
Why not?
Objection withdrawn.
You may answer.
Thank you. The propofol in any case that we handle is important. Probably more important than many of the other drugs that we deal with.
But when you saw those lorazepam levels in the heart blood and the femoral blood, those are very high levels, aren't they?
Actually, that's not what my testimony states. I said they're within therapeutic range.
Well, the propofol's within therapeutic range also, isn't it?
That's not what I said either. I said it's within a therapeutic range in the proper setting. This is not a proper setting.
What does the setting have to do with therapeutic range of a drug?
It's very important.
Think it makes a difference whether I take an aspirin at home or at work?
Objection relevance is to aspirin.
Sustained.
Therapeutic range is basically defined as the effect that the drug, in terms of the effect that the drug might have on the body, isn't it?
Correct. Desired effect.
Okay. Well, it doesn't take into consideration, and the literature, when they discuss therapeutic range, does not take into consideration where the drug is administered, does it?
The literature suggests that it has to be an appropriate setting.
What drug are you talking about?
I'm talking about any drug. I can name off several drugs for you.
Can you show me one piece of literature that discusses therapeutic range that conditions that range upon where it is administered?
I can't tell you today. I mean, I'm sure I can find the literature if you give me a little bit of time.
The lorazepam, you didn't do the calculations that you talked about today with regard to the 11 milligrams until this last weekend?
Actually, it's 2 weekends ago. I misspoke, but that's true.
Why did you do them then?
Objection relevance, Your Honor.
Overruled.
Because I was presented the information about the analysis that the defense did for lorazepam in the gastric sample.
Okay. Were you also presented with the analysis that the defense did with lorazepam in the urine samples?
Yes, I was. The 2 urine samples.
Okay. Did you do any calculations, special calculations for purposes of determining what that meant?
As stated before, the urine values don't mean anything. It's a historical perspective. It's an accumulation of drug in that reservoir.
Then why did you analyze the urine for propofol and for lidocaine?
Now, when we do a lot of our analysis, we're trying to do as thorough of a job as we can with the information that we have today. We try to answer all the questions that we think are going to be there. We can't anticipate all the questions all the way through. We thought we would do every specimen just to try to answer anybody's potential question.
Well, why did you analyze the urine for midazolam?
Remembering that most of the analysis is performed by many different analysts, each of the analysts will tackle the cases a little bit differently, trying to achieve the same goal. And this particular case, a criminalist Bud happened to do both the bloods, knowing that there are going to be small amounts of midazolam in those bloods. He wanted to substantiate the finding with a urine value, knowing that the urines are typically much more elevated as it's more concentrated.
So why did you do the urine for midazolam?
Because the values in the bloodstream are extremely low, and we know that the urine values are always much higher, typically. It's in order to substantiate the identification of the drug in the system.
How do the urine values usually relate to the lorazepam?
I expect them to be much more elevated.
And they were in the samples that in the results of the analysis that you've seen done?
That the sample split for the defense had done? Yes, I did.
Has your lab confirmed or the analysis done by my lab?
No, there's no reason to, because that's what I expected to begin with.
Okay. And the lorazepam levels in the urine are much higher than the midazolam levels, aren't they?
One more time, which two drugs are we comparing and what specimen?
Lorazepam to midazolam in the urine.
Oh, yeah, yes, very much so. The lorazepam is much more elevated.
Lorazepam levels would be 13 or 13 point something on the seen urine and 15 point something on the autopsy urine.
Well, I exactly haven't seen a document presented to me. I haven't seen it at all.
Oh, you haven't?
Well, I've got it in my book, but I haven't seen you present it in court specifically. So, I mean, unless you want me to find it for you.
Why don't you find it?
Okay. I have located it.
Okay. And the urine seen numbers, what are those?
The report from PAC Tox, PAC-TOX, lists lorazepam in the urine as 12,974 nanograms per milliliter.
So that would be 19, or that would be 12,900, rounding it up 13,000 approximately. That would be 13 point something in the seen urine, correct?
Correct. In making the conversion, it would be 13 micrograms per milliliter in comparison to the midazolam at 0.025.
So it's a lot more lorazepam, isn't it?
In the urine, yes.
And on the autopsy urine, the lorazepam would be 15 point something?